That many changes in her respiration itself, the main change is coming with the regenerative medicine. So he will tell us about his approach to regenerative medicine and the PRP, like what's really important, what to look into with PRP.
Yeah, I think Dr. Stan and Ryan covered everything extremely well, and I don't need to harp on much. I will say that pharmaceuticals are a mainstay of regenerative medicine, and we've seen great responses to topical finasteride. One of the concerns I had is they're making at Fag a 0.1% topical finasteride. My personal belief is 0.5% is the minimal effective dose. And as a cream, I'd put it in a liposomal delivery system. We discussed most of these things. Again, you got to characterize, for example, your PRP and how you make your fat. That's one of the things we're going to do today is process fat, and we're going to look at the cell numbers. And then we're going to do the flow cytometry to see what percentage, the cells are mesenchymal stem cells. One of the things about treating hair loss with stem cells is hair loss is not a disease. It's aging. It's just accelerated aging of the hair follicle. And so the whole idea of inducing some kind of trauma to the hair follicle prior to injecting stem cells might actually do something. We just have a limited number of cell cycles, kind of like the Hayflick phenomenon. And hair is one of those things that's constantly regenerating. And every time it regenerates, those telomeres come back shorter. And eventually they're gone. So how many cycles does a hair have? Only Brian Welter knows for sure. And he's not here.
He didn't want to tell us.
Yeah. So we'll ask him. So we're all living longer than we were supposed to. When I was born, I was supposed to live I'm pretty much supposed to be almost be dead, And now I'm supposed to live to 80 or 85. And that's, if I don't live a clean lifestyle, and you touched on all these important influencers on the cell, like NAD and antioxidants and senolytics like melatonin and fisetin, resveratrol, all that stuff. Peptides. The way you're approaching anti-aging is second to none, in my opinion. So we have this epigenetic stress that's what makes us die sooner. And so the cleaner life we live, stay out of the sun and exercise and stuff like that, that's what's going to help us live past 100. Then there's, genetic programming some people have. There's a tremendous interaction between fat and the hair follicle. So when the hair is actively growing, there's a proliferation of adipocytes. And when it goes into a resting phase, you lose adipocytes. You lose circulation, and bald scalps are thinner than hairy scalps. But there gets that point where the hair follicle is so far down the repetition line, the number of passages and life cycles, you can't bring it back. And that is a loss of stem cells. But how to reactivate or get the right cell signals into these cells is we don't know. We do know, like this erector pili muscle that's on every follicle is, oh, it might be on this slide, but it's not. So usually that erector pili muscle is going to be, I'll be right back. What happens with the erector pili muscle is it will lose its attachment with the hair follicles. And that erector pili muscle has mesenchymal stem cells that are very similar to those of the dermal papilla. So there is an interaction to those mesenchymal stem cells. The rest of the hair follicle, the outer root sheath, is all of ectodermal origin. And that interaction between these two different cell lines is what pushes hair into a growing phase. You know, it's downregulation of BMP and upregulation of the Wnt beta pathway. And the knobbing is what downregulates the BMP. Okay. I think there. So, this is Joe Biden, you know, in his 20s.
It looks better now.
Yeah, and he got plugged up. And then,
Okay.
yeah, we created some better techniques in the early 90s. It looks more natural. But unfortunately, he didn't do anything to help protect his hair. And that's why regenerative medicine is so critical, is we run out of donor hair. You know, we can move beard, sometimes other body hair works, but we need some kind of regenerative. So these are regenerative results without transplants. So we can get it back. And if we can add this to the surgery, we have a shot. This guy, I told him, you're not a candidate for a hair transplant, too much hair loss. I put him on a full-scale regenerative program, and 9 months later, he had this much hair. But the color was light, and the hair was fine, it was see-through. So at that point, I started grafting him. And I've moved 6,000 grafts on this guy to this point. You know, at 21 months, he basically has a full head of hair. But not without regenerative medicine. We don't ever get to that point. I'm not going to get too much into the history of PRP, but it's the dentist that brought it to us. As you increase the concentration of the platelets, the concentration of every growth factor goes up. And most of the growth factors, 90%, is released within the first 10 minutes of activation. And the rest, usually within about 90 minutes. There's no question that a higher density PRP will increase hair density. In fact, in my studies, I had a 50% increase in density at 6 months. But if you look at different PRP kits, some of them don't produce the same quantity of growth factors, and we actually saw a decrease in hair density. So you compare, let's say, the Angel Arthrex system to Regen, and Regen is just, it's junk. And most of the guys using it are orthopedic surgeons, but for hair, it's literally junk. And the capture rate is something you got to know of your PRP kit, because that's how you're going to concentrate it. And it's one of the ways. But in order to really do it well, you got to get a baseline CBC. It's absolutely critical when you're doing PRP. If your patient comes in and he's got a baseline of 80,000 platelets per microliter, you know, he's thrombocytopenia. And you can't make the same volume of PRP. You've got to decrease the volume. There's ways to calculate how you do that. Angel Arthrex has a capture rate of 35%. It means you need 120 cc's to get an adequate volume of PRP. If you get something like Insight, which is about a 71% capture rate, you can get very high concentration, sometimes enough volume to treat a whole scalp, but I prefer a little more. And then you can concentrate things like Insight and Magellan to way above what you need, way above. But for here, we need about, I like 6 times the capture. And I want about 1.5 million platelets, just like Ryan said. And so to be able to do it, I've got to have a baseline PRP. And this is the formula to calculate it. Your platelet capture rate. But I also have a means of estimating. So if I know my capture rate, I can use this little formula at the bottom to determine how much PRP I can make from a 52 cc blood draw. But the problem with all these kits is there's no consistency. There's no consistency. Look at this one. This is the same patient, same blood draw. One of them, this is Insight, had a capture rate of 73%, and the other one had a capture rate of 57%. They came out of the same kit. So, same blood draw, same patient, different results. Now, what I like to do different than anybody else I know is I lyse my platelets. So you can see I went from around 1.9 million per microliter to 6.3 thousand. And that means I am turning all my platelets into pure cytokines and growth factors. And that does have an influence. So that low PRP level there is where most of the platelets are. But when we talk about capture rates of like 73% or 35%, where's the rest of the platelets? You know, they don't just blow up. They may clump. But you will find them in every single cc of that red cell fraction and every single cc of the serum. So they're all there. But we can't find all of them. So I did a sort of a segmental analysis of it. I used my hemocytometer and I analyzed it. So in the PPP, there are about 4.1% of the platelets. In the PRP and Buffy code, you got about 70.22%. And in the red cell fraction, 8.86. It totals up to 83%. That means we're missing 16% or 17% of the platelets, right? So some are stuck on the wall, some are stuck here, there, and everywhere. But lots of them. Now, I'm just going to show you. I try to sonicate. This is why I don't like activation. Now, platelets have two functions. One is to heal, and the other is to stop you from bleeding, right? So this clumping is what kind of helps stop the bleeding, but it also creates the activation. I like to just get pure lemon juice, not all that other cellular debris. And does it work? Yeah. So I sonicate it. It does create heat. If I don't chill it to 4 degrees Celsius, the blood will turn into albumin. Because this does create a lot of heat. Now I just go into this. 2 different kits, sonicated PRP versus traditional activation, and we're looking at a specific growth factor. In this case, it's PDGF, and there's an AB, BB, this is BB. PDGF is a heavier growth factor, so it's like 24.3 kilodaltons. And you get about 5 times the concentration of the PDGF if you sonicate. And why is that? That protein gets trapped in that clot. So it's like a screen door. The little bugs can get through, the big bugs can't. And you just keep VEGF, another high molecular weight protein, 5 times the concentration, TGF, same thing. And the kits matter too. Concentration and growth factors vary by the kit. What low molecular weight protein are going to come out in equal concentrations. All right? So IGF is a very important protein, but we do increase density with high density PRP. And I did a study, compared half-head study, and I looked at the regrowth. And it's not very common to have equal hair loss on both sides of the head, so I was really lucky to find this guy. On one side, I put traditional PRP, high density. On the other side, I sonicated, and then I did a calcium gluconate activation on the other. The side with the sonication grew in much faster, and I'll just go on to the results of my study. With sonication, I got 99% growth at 4.5 months. Okay? It's much higher than traditional PRP. And this is same in high density PRP. Let's talk about injection depth. What we got here?
Activation of PRP. This is
I love it. Is this a light system?
Yes, yes.
Okay, I can't wait to try that.
It's
Yes,
cell
nice.
technology, so technology with light activation.
All right, so ultrasound gives the highest axial resolution, much higher than MRIs, much higher than CT scans. A 70 megahertz ultrasound will give you an axial resolution of I think 40 pixels. Like 40 per pixel versus around 400 for an MRI. So you don't get that detail. So if you use a 70 megahertz ultrasound, you can see the hair follicles.
Which is very superficial way of
Yeah. So those, in ultrasound you have hyperechoic, which is white, and you have hypoechoic, which is black. So those hair follicles are really black structures. So let's think about injection depth. Because they're on an angle, and I can take out a hair follicle and tell you what the depth is, but the average is 4.9 millimeters. So if I inject this, and this is about 43 degrees, the base is at 3.34 millimeters. So if you're going 4 millimeters deep, you're missing that follicle. So you really want to be in that higher structure, somewhere between 2 and 3 millimeters. But if the hair follicle is growing at a more acute angle, in this case, you've got the bulb at 2.45 millimeters. So it's kind of good to know what you're doing. This is just ultrasound guided needles. And you can see, if you have the ultrasound, you can kind of see what depth you're at. But if you're going at an angle and you have a short needle, you can do it. But the minimum, you shouldn't go above a 21 gauge needle with PRP if you've got intact platelets, because it will shear. You shouldn't draw PRP with a cannula or a needle smaller than 21 gauge. And so 1920 is even safer because it eliminates the shearing effect. So if you can find a 4 millimeter needle that's about 20 gauge and go at an acute angle, you're going to be at the depth. I won't going to go much into all this. We've looked at a lot of commercial kits and we see guys that thought they were making PRP, were not. Like this Vacusera, it had 37,000 platelets in it. It's not PRP, it's PPP. These are one on the top is Next, which is T-Lab. They actually have very high capture rate, but we're going to compare them all to that. We'll get that data back from the lab. And so I looked at dermal papilla proliferation and compared a number of growth factor-rich medium, everything from exosomes to adipose to amniotic membrane to high-density PRP. And the first thing to look at with dermal papilla proliferation is that it's concentration dependent. So the higher the concentration of growth factors, the better the proliferation. There is no correlation to migration. And let's just compare the exosomes. So the base medium is just standard culture medium. And the positive control is fetal bovine serum plus all kinds of additives like FGF7 and whatnot. When you look at proliferation, the actual best proliferation was derived from adipose-derived stem cell culture media. High density PRP was like right behind it, amniotic membranes right in there. But the exosome, this was bone marrow derived exosome. That was really, I think, critical to the source. And of course, the bone marrow, it's not a newborn, right? It's not T0. But it didn't have any influence on the hair follicle, really. The exosome proliferation was just better than the base medium. And if you look at FGF7, which is a potent initiator of a cell cycle, it pushes that cell into a division, all right, turns it on. Exosomes underperformed everything. Clean media doesn't do much for FGF7 production. But all these other, growth factor rich media have an influence on FGF7 production. So again, normoxic adipocyte stem cell culture media was number one. This is kind of what we're going to try to do today. Compare different kits to determine the total number of nucleated cells. So we'll get that data today with Lunastein. Then we have the flow cytometry, which will give us the characterization. In this particular study, the microlyzer outperformed adenine, and tulip was very disappointing. We did another study in Bangkok last July, and tulip did better, but lipocube was like number one. Adenine was two. It was third, right?
Yeah, I gotta say one comment. I think, and I don't know if you agree, but I think that's one of the things we kind of learned from that, using the lipocube in that visit, is that I think this 30 pass thing, or 20 pass with the tulip, I think is too much.
It may be. I've spoken with Ramon all about that, and I know David especially likes Ramon. But Ramon said they studied the number of passes. And the reason they went to 30 was that's where they got their best cell count. But he almost exclusively works with tulip.
Right.
I don't know that he has worked with any other company.
Well, I think it really kind of piqued my interest, because I think that that's what we kind of need to do. I think that perhaps it might be very well that you need several passes at the 2.4 millimeter to break down the adipocytes, but that you might not need as many passes when you get down to 1.2 or something like that. So
yeah,
might be
tulip
harmful.
one pass, and with the microlyzer, we get to compare it, because they pushed us to 101 passes with the 41 micron filter. So that's going to really tear up a lot of cells.
Yeah. Well, there's so much here for us, so it's hard to know.
Yeah.
That we need that small, very small orifice,
So one remark to them at IMCAS was, why don't you take the 41 microns filter and study what's stuck? And I asked them about that, and they were not very clear with the answers, so they don't know yet.
Yeah, I don't think so. Yeah.
Yeah. Well, I'm not going to take up any more of your time. I could go for hours.
That's what I'm
not. We had such a great lecture earlier.
Thank you very much.
ForHair is run by Dr. Cole with 30 years of hair restoration experience, and we offer the most cutting-edge technology available. In fact, the ForHair Enterprise sub-company Cole Instruments manufactures custom-made tools and automated tools for hair restoration physicians all over the world. Our quality, expertise, and skills are superior to other clinics. Our reputation and results are the best in the world. It's time to restore your hair. It's time to choose ForHair. We hope you enjoyed the video. Don't forget to hit the little bell button to get notifications of ForHair's video uploads. For online consultation, click on the link on the screen or in the video description.